Good morning. My name is Karen Curtis, and I am a member of the Provider Outreach and Education team here at WPS. I will be one of your presenters for this webinar. Joining me is my friend and coworker, Aline Sigler. You're going to be hearing from her later in the presentation. We want to thank you for joining us for Medicare Appeals, a Practical Guide. Now, the purpose of this webinar is to increase knowledge of the appeals process and the tools that can help with its successful submissions. I'll start with an overview and submitting appeal requests. Then Aline is going to cover self-service tools that are available, tips and reminders for hassle-free submissions, and where you can find help when you need it. We'll begin with an overview of the Medicare appeals process. For some of you, this may be a review of information that you're already familiar with. For those who are new or just beginning to learn about Medicare and the appeals process, this is going to provide a brief introduction. As your Medicare administrative contractor, WPS processes original or fee-for-service Medicare claims. You may also hear this called traditional Medicare. Medicare Advantage, which is also known as Medicare Part C, is an alternative plan that is offered by private insurers. So their appeal process may be a bit different. I just wanted to provide this clarification before we get too far into the webinar. An appeal occurs when a party of the initial determination is dissatisfied with the results and asks that the contractor make a redetermination. In other words, they're asking for a reevaluation of the facts and findings. Now, this can be done in situations where a party doesn't agree with Medicare's determination on coverage, payment, or services. Now, I've used the term party, and I'm doing quotation marks in the air, a couple of times, but let me define that further. A party is a person or an entity with a right to appeal an initial determination. So this includes the beneficiary, participating provider, suppliers, or an applicable plan such as liability, no fault, or workers' comp insurance. The appeal process also consists of multiple levels as well as contractors and independent organizations. And if we think about it, it makes sense that multiple entities would be involved. It's designed to ensure that fair, independent reviews where new information or new evidence can be presented. So, you don't want the same person looking at it every time. Now, there are 5 levels involved in the process. We're going to take a closer look at each of these steps. Level 1 is the redetermination, which is conducted by the MAC. It's a second look at the services and the supporting documentation from the initial claim. The next level is a consideration, which is performed by the Qualified Independent Contractor, or QIC. This consists of a panel of physicians and other health professionals who will review the services or items rendered. Next is a hearing before an administrative law judge or attorney adjudicator review at the Office of Medicare Hearings and Appeals. Level 4 is a review by the Medicare Appeals Council. And the final level is a judicial review in the U.S. District Court. Appeals must begin at the first level and they must go in order. Each level has certain steps that must be taken before appealing to the next level. If all the steps are met at a specific level, then the requester and any of the parties that are in the appeal decision is allowed the right to appeal to the next level in the process. Now, although there are 5 distinct levels in the Medicare appeals process, The redetermination, which is level 1, is the only level in this process that the MAC performs, and that is what we are going to focus on today. Now, on the last slide, I mentioned that a redetermination is a second look at a claim and the supporting documentation that had an initial determination made. Since both the initial determination and the redetermination are performed at the MAC level, staff involved with that initial decision cannot take part in the redetermination review. This way you get a second set of eyes looking at the information. And it's just like a second opinion at a doctor's office. You're going to see a different doctor to get a fresh perspective. This is also a CMS requirement. So even within the appeals department, there has to be a separation of duties. So there's registered nurses who make up the clinical staff. They do those reviews of looking at the documentation, seeing if the services are medically necessary. But then there's also non-clinical staff, and they have claims processing experience. So, they're working to get those claims through the systems, doing things like that. Now, there are multiple actions that can be taken depending on the situation. First, we have an inquiry. Now, for non-overpayment cases, if you are unsure of why your claim or line denied and you aren't sure if you should appeal, you can call our customer service line to inquire about the denial before submitting an appeal. If you have questions related to your overpayment, the WPS website does have a topic center which is dedicated solely to overpayments. There you're able to find resources, FAQs, and forms all related to the overpayment process. Clerical error reopenings is a cost-effective way to correct minor errors without using the appeal process. This includes errors such as transposed procedure or diagnostics codes, inaccurate data entry, incorrect use of a modifier, for example. Clerical reopenings can be submitted through our portal, by phone, fax, or by mail. Now, using this secure net access portal is much faster and a more efficient option. If you're a provider who submits claims on a UB04 or an 837I, then performing an adjustment via direct data entry or DDE is an option. This can be done to make changes to a finalized claim. So examples would include like changing the date of service. Maybe you need to change a revenue code or a procedure code. And you can even do an adjustment to change the primary payer. If the claim denied because Medicare wasn't the primary payer, you can do an adjustment and add that primary insurance information. Lastly, if there's a service on your claim that you feel has denied an error and there are appeal rights, you can submit a redetermination request along with documentation that supports your denied service, and you can have that reviewed. So now that we've covered that background information, let's talk about submitting your requests. We want to do our best to make sure that you not only know what you should be submitting for an appeal, but how to submit an appeal and what is needed. Now we'll start with checking to see if the claim can be appealed. There are a few tools that can help you with this. First is the remittance advice. Here you can find payment information. If the claim did not pay in full, you will find claim adjustment reason codes or CARCs, and the remittance advice remark codes or RARCs, and that's going to provide an explanation as to why that claim did not pay in full. If you're a Part A provider who bills in FIS, you can sign up for direct data entry. One of the options in DDE is to view the reason code, which will also display appeal codes. Lastly is the WPS Secure Net Access Portal, or SNAP. This is normally just referred to as the portal. Here you have the ability to view the status of your claims, and then within the claim status detail view, you're going to find reason and remarks codes that give you information regarding claim payment, as well as claim action buttons for starting the redetermination process. So here you see a couple examples of remittance advices. Depending on the vendor or software used at your facility or office, yours may look similar to what you see here, or they may appear different. I just wanted to provide examples of where those codes are going to appear. Now, in the example on the left, the RARC codes appear in the upper right, and then at the bottom, you can find a definition of what that code means. So here it tells you that the MA01 means that if you do not agree with what was approved, you may appeal the decision. The remittance advice on the right looks a little different, but you can still see those RARC codes in the upper right corner. Now I mentioned DDE. So if you are a provider who uses FIS, one of the options available within DDE is reason code lookups. So at the main menu, you're going to select option 1 for inquiries, which is going to bring you to the menu that you see here on the left. You'll then select 17 for reason codes. You'll type in that 5-digit reason code, that is found on your claim, and you're going to press enter. You'll then select F8, and then that's going to show you those ANSI related reason code inquiry. So on the right side of this screen, I've indicated where those appeal codes will appear. So, a lot of MA01 is a code that you see a lot when you do have appeal rights. So that would show up in that section in red where it has appeals A and B. Now, if you're a portal user, there are a couple different ways to determine your appeal rights. On the left, you can see an example of the claim detail screen. For each line, the system provides reason and remark codes, and I'm not sure how clearly you can see it, but there are lines under the CO, the 45, and the B13. So if you hover your mouse over those codes, a pop-up box with the code description will appear. I find it a little small and it could be hard to read, but you can also select the eye icon in the more info column, and that's going to provide the information you see at the bottom of the picture. So it just makes it a little clearer and a little easier to read. Now the picture on the right shows the claim action buttons that can be found within the claim details. So you will notice that some of those boxes appear gray while others appear blue. The gray means that the action is not available, while the blue means that the action can be taken. So you can see that the request determination button is blue, meaning that the claim has appeal rights. Now, in some of the examples we looked at, you can see that the RARC descriptions are relatively easy to find. But what if that isn't the case? What if your remittance advice doesn't provide that information? Or what if you looked up the reason code in DDE and you just don't know what the codes mean? A couple of the resources on this screen can provide descriptions when all you have is the code. The DDE inquiry menu not only has the reason code lookup, but it also has an ANSI standard codes inquiry, which will allow you to type in the CARC or the RARC, and a narrative will be provided. Another example that we haven't looked at is the X12 website, which is linked in the last bullet. So if you're someone who works a lot with electronic claim submission, you may be familiar with this website, but here you can find a list with descriptions for many codes, and I've listed how to find those remittance advice codes underneath there. We can go out and take a look real quick here. So for example, under the external code list, if we see all codes, we have the remittance advice remark codes. And so you can just take that code that you get on your, your remittance advice, or maybe you found it in FIS, or whatever way it's been provided to you, and you can look it up here. I know that one of the codes that appeals has mentioned that a lot of people don't know does not have appeal rights is the N211. So if you see that code on a claim, you can look that up, and it specifically tells you that you may not appeal this decision. The MA01, which is one that we said that appears a lot, tells you that you do have appeal rights. So that's just another level of um, tools that you can use that is going to let you know if your claim has appeal rights or not. So to get things started on the right foot, you want to make sure that you're submitting a valid request. Regulations require all determination requests be in writing. Requests can be submitted electronically through fax or the portal or by mail. CMS provides a redetermination request form if you choose to use it, but it is not required as long as your request contains all of the same required elements. When you submit requests using the portal, many of the fields within that request are auto-populated. So that is something that can save you both time and effort. Requests must be submitted within 120 days from the date the claim processed. It is important to remember that WPS does have 60 days to issue a decision. Finally, you want to make sure to include all documentation to provide medical necessity for the service or services in question. Now, this slide lists the items that appeals staff require and that every request should include. First, they'll need details about the beneficiary, their name, date of birth, and Medicare number. They also need details about the claim, the exact dates of service, the claims document control number, which is known as the DCN, and the name and address of the provider of service. In addition, we highly recommend including the provider's phone number. This way, if there's questions about things, Appeals has your contact information and you can get things worked out quickly. Using the provider's letterhead is an easy way to include these items. Let us know the specific items or service you're appealing and the reason for the appeal. We need a clear explanation of why you disagree with the initial decision. They need requester information, so your name and contact details or your representative's information if that's applicable, and a signature. Send this along with the supporting documentation or any additional documents or records that help your case. Now, some important reminders about timeframes. The request for redetermination must be filed within 120 days from the date of the initial claim determination. So this is the date on the remittance advice or on the Medicare summary notice that the beneficiary receives. MACs have 60 days to make a decision once they receive a valid redetermination request. So you want to make sure that you don't submit an additional redetermination on the same service during this 60-day period. Duplicate submissions cause unnecessary costs to the Medicare program, and repeatedly sending duplicate requests could be viewed as waste or abuse. For Level 2 reconsideration requests, you have 120 days from the date of receipt of the redetermination decision. However, if you are requesting the quick to review a contractor's dismissal of a request for redetermination, That time limit for filing a request is 60 days from the date of receipt of the contractor's dismissal notice. Please submit your second level request to the appropriate QUIC, which will be listed on your redetermination decision letter. So what happens if you miss a deadline? Can you still submit your request? Now, this is a question we get asked a lot. CMS does allow MACs to extend the time limit for filing an appeal if good cause is shown and it's documented within the redetermination decision letter or case file. Now, examples provided by CMS include circumstances beyond the beneficiary's control, such as an extended illness or if there's communication difficulties, incorrect or incomplete information about the claim and or appeal if that was given to you by CMS, the contractor, or the Social Security Administration. And then also unavoidable circumstances that prevented the provider, physician, or other supplier from timely filing a request for redetermination. Examples that were provided by CMS include natural disasters. At the bottom of this slide, you will find a link to the Medicare Claims Processing Manual, Chapter 19. And CMS does provide detailed examples. So if that's something that you're wondering about and you want to know what CMS considers to be good cause, the best place to go is directly to that manual. So now I would like to turn things over to Elaine. She is going to go through the remainder of the presentation. I am going to stop sharing my screen, and she's going to start sharing hers, so you're going to see a few flickers.
Well, thanks, Karen, for that great information. My name's Aline Sigler, and I'm just going to pick up where Karen left off. You know, at WPS, we have a lot of people who are continuously working on ways to make things easier for you, to help you do things more independently, faster, more efficiently. And so we have a lot of self-service tools. And that's what I'd like to do now, is just show you some of the tools that we have that can specifically help you with your appeals and the appeals process. So we're going to go down this list here, and then we'll go into detail just a little bit for each one of these. Karen talked a little bit about these too, so I want to go along with what she said. Now, first off, if you're a Part A facility or institutional provider, you can get access through a vendor to direct data entry. So that's what we call DDE. And then the next one we have here, and you might not consider this a self-service tool, but just like Karen showed us, the remittance advice contains a lot of useful information, and so we can use that to help us with our appeals. We also have our interactive voice response tool. That is the provider's claim status tool and self-service help as well. And then the provider portal that we have, known as SNAP, Secure Net Access Portal. You've heard that a couple times already this morning. And then your Medicare redetermination notice. So as we start out with direct data entry, that's a great tool for our Part A providers. DDE users can check claim status, and that way you can know more quickly if a claim is pending with a prepay additional documentation request, or ADR. So looking in direct data entry, you'll know right away if you have a claim that's pending for medical review. A lot of appeals stem from claims or services that are denied upon review. And checking claim status is part of watching your claims through to adjudication. I don't know any biller that sends a claim and just hopes for the best. We watch those claims. We make sure that they get all the way to our remittance advice, hopefully in a paid manner. So with DDE, you can also correct claims that might be pending with errors to avoid denials and the need for appeals. If I can insert a tip here, an example of something you can correct within DDE might be a missing or an incorrect diagnosis code. When adding diagnosis codes to your claims, be sure to place them in the diagnosis codes field and not just the PRV, patient reason for visit field. We have seen this a few times, and you run the risk of automated edits overlooking that diagnosis code and the service being denied when it shouldn't have been. This is especially important for those items and services that are covered or not covered based on diagnosis, like local and national coverage determinations. Within DDE, you can also adjust or rebill some of the unpaid claims that are not appealable. We have a DDE manual on our website that has a lot of details and instructions for all of these different actions you can take. And you can find it on our website in the right-hand side. When you first go there, we have a quick links box or a section, and you can link right to that DDE manual there if you want to learn a little bit more about it and see if it's something that can work for you. If you don't see it when you go to our website, make sure you're on the Part A side because it is only a Part A function. You can use your remittance advice as a helpful tool to investigate claims or services that are not paid. And then you can become familiar with the codes that will let you know right away if a denial has appeal rights. Karen showed you an example of this. The two remittance advice remark codes. We have to have acronyms in the Medicare world. That's just how it goes. So RARCs. The ones that are on this slide are the ones that correlate to those first two levels of appeal. You can also use your remittance advice to investigate any non-covered charges. So if you didn't bill charges on your claim as non-covered, and when you get your remittance advice and you see those non-covered charges, you could go back to direct data entry to look at that claim, bring up those denial reason codes, see what the reasons are, and then plan your next steps after that. If the redetermination decision results in payment to you, so you have a favorable decision, you got a denial, you appealed it, it was overturned, you're going to receive a remittance advice that shows that the claim was reprocessed and Medicare allowed payment. So that remittance advice is important. When you're analyzing and posting your accounts receivable, we encourage you to check your remittance advice or the Medicare redetermination notice for the details about your appeal decision. So by doing this, you can efficiently know the status of your redetermination. Another tool I want to mention is our interactive voice response or IVR system. It's a self-service tool for providers who are inquiring about claim status, payment information, and other general information. Appeals information that's available on the IVR after authenticating is the number of appeals for the date of service, what level of appeal you're on with a particular claim, the status of the appeal, whether it's open, closed, or reopened. It will also give you the receipt date and the decision date. You can hear the appeal disposition, whether it was favorable, partially favorable, unfavorable, misrouted, dismissed, or unspecified. It's also going to give you the MAS number, which stands for the Medicare Appeals System, and then it's also going to give you the claim number or the DCN. Those are all things that you can hear from our voice or touch tone activated IVR. Snap is probably going to be your best friend. Our portal is a very important tool. Among other things, the portal provides claim status for both Part A and Part B providers. Providers can use the portal to submit a redetermination request, to submit a Part A reconsideration request, which is that level 2 appeal. You can check the status and outcome of a portal submitted redetermination, and you can track a redetermination request that's been submitted by mail or fax. You can also use it to submit a clerical error reopening to correct those minor errors that result in an initial claim denial or reduction of payment, like Karen explained to us. If your redetermination does not result in additional payment or results in a partial payment, so it's still an unfavorable decision, you're going to receive a Medicare redetermination notice, or MRN. And you're going to review that MRN notice carefully, because once your redetermination is complete, you're going to get this letter from WPS, and it provides the rationale for that unfavorable redetermination decision. CMS requires us to outline the specific reasons for the decision, along with a summary of relevant clinical or scientific evidence that was used in making that decision. Your MRN also includes notification of the right to appeal and instructions on how to appeal that decision to that next level, which is that reconsideration, which is processed by that qualified independent contractor, or QUIC, that Karen mentioned. So we work very closely with our appeals department. We get a lot of information sharing, going back and forth in what they're seeing with redeterminations, and they give us guidance as far as tips and reminders to share with you, so that we can help you get your request submitted successfully and processed efficiently. So we want to avoid those situations that can delay processing of your redetermination requests, or that can cause unnecessary dismissals. You can't request a reconsideration if a redetermination has not been completed. And this goes back to what Karen said about them having to be submitted in order. Sometimes I think that this is a misunderstanding of the process, or maybe some terminology, which is part of the reason for this education that we're doing and our collaboration with our appeals department. Another instance that we're seeing way too often is a redetermination request that should actually be an inquiry, an adjustment, or a reopening. Not every unpaid claim has appeal rights. The next thing that we're seeing and that we want to avoid is not filed within the timeline for submission. I know we're just talking about redeterminations today because those are the ones that we process at WPS, but all 5 levels of appeal have a time limit associated with them. And they're not all the same. They range from 60 days to 180 days, depending on the level. Redeterminations are 120 days. If you miss that time frame and you can't prove just cause for late filing, your request may be dismissed. So it's not even getting to the point where someone's going to take another look at it because you didn't meet that criteria, or tell us why you couldn't meet that criteria. Karen talked about the required elements to send with your appeal, or that make up an appeal request. If your appeal request is missing key information, including signatures, it can't be processed. And this last bullet here, this is a big issue lately, and that's duplicate requests. We definitely want to avoid those. Submitting duplicate redetermination requests wastes time for you and for us. It also wastes money for both you and the Medicare contractor. It can also have adverse effects on the beneficiary. So your patients, they might get multiple Medicare summary notices. They get confused or anxious by those multiple copies of notices about things that aren't paid on their behalf. And we really have to avoid that. We have some reminders that are going to help you avoid submitting duplicate redetermination requests. We already talked about timelines for submission, but also observe our timelines as well. MACs have 60 days to make a decision once we receive a valid redetermination request. Don't submit an additional redetermination on the same service within that 60-day period. You can use our portal to monitor the status of your redetermination request or any of those other tools that we just talked about. Review your Medicare redetermination notice carefully once your redetermination is complete. It's going to tell you why it was either upheld or overturned, and it's going to give you information about further appeal rights that you might have. The appeals department does receive a lot of requests on paid claims, indicating that the provider doesn't feel that the payment is correct. Many times the provider states that they feel the claim is underpaid or overpaid without providing additional details. After investigation, approximately 96% of these requests on claims, the claims are actually paid correctly. So that is taking time and effort, manpower away from those actual appeals, and so we want to avoid those as well. So we've included some tips here to help both our appeals department and you. If you truly believe that your claim was not paid correctly, give us details as to why you feel that way. Is there a certain HCPCS or CPT code that you feel paid incorrectly? Provide your calculation details in your request so the issue can be identified. Verify your payment using a web pricer before you submit a request. Is the problem on our side or on your side? You know, by doing that investigation, you can kind of see where the discrepancy is. This slide contains links to a lot of different tools here. The web pricer can be used for claims that are paid under the prospective payment system. Applications are available for each of the facility types shown here. Under the other resources, you can find links that can be used for determining payment for outpatient services and physician or supplier claims. So if you've downloaded a copy of the slide deck, you have these hyperlinks here. If you're listening to this event as an encore, look in the description of the video and we'll have the links there for you. When you're verifying payment, remember to deduct any pass-through amounts, coinsurance amounts, or deductibles from that total amount. Now, I want to take a few minutes to talk about some other frequent trends that we've identified with our appeals. Handling these situations appropriately can save you time, frustration, and maybe even decrease your workload. When we look at trends in claims data, timely filing rejections is almost always in the top 5, no matter which provider type is submitting the claims. These claims, these denials or rejections for timely filing do not have appeal rights. So you don't want to request a redetermination. There is action that can be taken if your claim meets certain criteria. CMS has outlined some exceptions that may constitute good cause for extending the timely filing limit. Administrative error, retroactive Medicare entitlement, retroactive entitlement involving Medicaid, and retroactive disenrollment from a Medicare Advantage or a PACE provider organization, which is a program of all-inclusive care for the elderly. In each of these different situations, requests are going to be sent to the claims manager, not the appeals area. There is a list of state-specific addresses, depending on where you're located, and those can be found on our website. Medicare secondary payer situations, that's another situation that is not considered good cause for timely filing. If another insurance is primary to Medicare, go ahead and file a claim reporting the primary insurer's payment or denial. Even if a primary insurance pays a claim in full, we do recommend that you still send a secondary claim to Medicare for reporting purposes. So if that primary insurance comes back, let's say months, years later, and takes their money back, you've got a claim in the system that was timely at the time that it was submitted. So you can help yourself in those situations. It might not happen often, but if it does. So those situations where Medicare is the secondary payer and those denials for that reason are another common rejection on claims. And they're also not appealable. So redetermination requests are not an option. This is only going to cause delays in the processing of your claims and other redeterminations. If you're a provider who bills on a UB04 or the 837I, you can do adjustments sometimes to correct information that was originally submitted on your claim. If you're a provider who bills on a CMS 1500 or the 837P, a new claim can be billed containing the correct information. There are steps that can be taken in hopes of avoiding a rejection altogether and eliminate additional work. If the beneficiary has a workers' compensation, liability, or no-fault insurance, and the services do not pertain to the diagnosis shown on the MSP record, you can add a comment in the remarks or narrative field on the claim. And for UB04s, we have an example here. So in the remarks, you can add not related to workers' comp, not related to liability, whatever the case may be, to further explain the situation and give the system and the claims examiners information to know that, yes, they do have a workers' comp or liability insurance, but your claim is not related. You can use an admission questionnaire when the patient is admitted or when the services are rendered to make that process easier as well. CMS has created examples of sample questions that you can use. They're in the Medicare Secondary Payer Manual, which is publication 100-5, and that's the link we have for you on this slide here. In Chapter 3, in this section 20.2.1. Now you aren't required to use the questions that CMS has put together as long as you capture all the same information. SNAP can provide you with primary insurance information by completing an eligibility check. And this option is available to all registered users of SNAP regardless of your access level. The last option shown on this slide here is HETS, the HIPAA Eligibility Transaction System That is something that you can find more information about on the CMS website as well as, a user guide. Some additional tips and reminders are listed here. I know Karen mentioned this, but just to be sure to let us know the specific items or services that you're appealing. Not just, I disagree with how this claim processed. We need more information than that. Specific items or services you're appealing and the reason why you disagree. We need a clear explanation of why you disagree with that initial determination. Check the status of your appeals before resending it again. We talked about duplicate submissions. They cause unnecessary costs to the Medicare program. And if we have providers who are repeatedly sending duplicate requests, this can be viewed as waste or abuse, and we don't want to get into that habit. Providers are responsible for providing all the information that's required to adjudicate the claim at issue, and you should submit documentation that's related to that initial denial reason. But you do not need to resubmit previously submitted documentation. We create a case file, and that case file contains all that documentation that was previously sent, and that will be forwarded to our appeals department. This includes documentation that you might have submitted to an initial medical review contractor, such as CERT, the RAC, or the SMRC. Those are some additional medical review contractors that you might have had requests from. Again, there's a case file that's created and the documentation is shared. Documentation submitted for an appeal should only include new information to justify medical necessity. Along those same lines then, only send the documentation that's relevant. Do not automatically send the entire chart if it's only one line, one item, or one service on the claim that's being appealed. Unnecessary documentation is not helpful. So it's about quality of documentation, not quantity. If you work with third-party vendors or billing agencies, make sure you're working closely with them. Make sure that you're educating them about proper submission practices. They're working for you on your behalf. Our appeals department is seeing an increase in what we believe to be artificial intelligence or other automated processes where the minute that a claim is processed, we're receiving an albeit generic redetermination requests that isn't giving specific details that we need. While we strongly encourage the use of electronic submissions, you are allowed to send appeal requests by mail. If you choose that option, be sure to verify that you're mailing it to the correct address so it doesn't get misrouted and held up. Again, this is going to help expedite your request, get it to the right place as quickly as possible so that we can get started on it. So by following these reminders, hopefully we can streamline that process and help facilitate successful appeals requests. If you're going to the second level of appeal, that reconsideration, and you're going to be mailing your request for reconsideration to the quick, the next tip is for you. It's not a requirement, it's a recommendation, but we ask that you attach your Medicare redetermination notice to the top of that request, or at a minimum, add the redetermination number with your request. In the portal user manual, the redetermination number is referred to as the CCN, Correspondence Control Number. So this is the tracking number that's used to identify the appeal request in the claims processing system. On your Medicare redetermination letter, which is the screenshot that we have here on this slide. This is located under in any inquiry referred to. There'll be a number there. So we just provided a sample here so you can give you an idea of what we're talking about here. Here's another way that you can help us facilitate successful appeals. WPS has a survey for those of you who have submitted a redetermination request in the last 90 days. Using your input from those surveys is crucial in helping us improve our processes. You can find a link to that survey on the right-hand side of our Appeals Topic Center on our website. So we have this screenshot here to just kind of show you the location. When you go to Topic Center and Appeals, and you're on the Guides and Resources page, which is what it defaults to, you'll see that there. If you are responsible for submitting appeals at your office or your facility, there are going to be times inevitably where you're going to hit a snag and you don't know what to do and you need help. So the first thing that I recommend you do is familiarize yourself with the basics of the appeals process and those guidelines. And you're doing that, and we know that you want to do that because you chose to attend today's webinar. Or somebody told you that you had to maybe, but at any rate, you're here getting the information. Number two, if you received correspondence regarding an appeal, take a look at who it came from. If you need help, sometimes you can use that contact, that particular individual or email address to ask about your specific question. Number three, and this is a big one, use those self-service tools. Not only is it quick and easy, but it's also required. Our customer service area is prohibited from providing information that can be obtained from self-service tools. That's not a WPS rule, that's a CMS rule. Finally, if you've tried all the things and you still need assistance, you can call our office. When you do, you'll need the information that's listed here. You'll need your NPI, your PTAN, the last 5 digits of your tax ID. You'll need contact information. You can find that contract specific information on our website under the Contact Us area. The Appeals Topic Center of the WPS website has a lot of the items that might be of interest to you that can enhance your knowledge. So we want to go there real quick, and I know we're running short on time here. Oops. But I want to show you here, and I have a link just to try to get out there so I can show you a couple of these things. So on our homepage, when we go to the Topic Center up here in this top banner, drop down, choose Appeals. And like I mentioned, it's going to default to the Guides and Resources there. So I just want to pause here and show you this green banner because this isn't as noticeable as that bright blue one. So you can choose Guides and Resources. Like I said, it's going to automatically go there. You could also choose to look at news and updates related to appeals. We have frequently asked questions, which is really good. And then we also have a section specific for forms related to appeals. The forms area is going to display the forms that pertain to the contract that you've selected. I am in J5 Mac Part B. So here are the different forms that you might need. If I change contracts, let's say I go to Part A, you're going to see they're different. So make sure you're in the right area for your contract and you'll get the most specific items because those selections do change. If we go back to the Guides and Resources, you can see that we have items that are frequently selected. At the top here, we have the forms selector. We also have an article, How to Appeal a Claim Due to Redetermination. If we select the different topics right here, you can see that we have different items listed, and we can expand these. The redetermination area, you can see we have 4 different items listed here. We have an article addressing duplicate redetermination requests, which we talked about. We have an article with instructions for appealing a claim determination. All these different things. This appeals form selector is an interactive tool that asks you a set of questions, and depending on your answers, if your item is appealable, it will give you the form that you need. And so it's really a good self-service tool that you might not have been aware of. Now, before we leave our website here, and I know I'm going quickly, I apologize for that. I also want to show you our tools area up here in the top navigation. If I select tools and all tools, there's a couple things that I want to show you here. We have, I'm going to scroll a little bit, the Universal Date Calculator. This is a great tool for calculating that 120-day time limit that we've been talking about today. So if I select that tool, redetermination, it's going to default to today's date, but let's just choose, April 1st. So if you have a claim that processed and your date is April 1st, July 30th of 2026 is the date in which we need to receive your redetermination request. So that will be a good tool for you if that's something that you're interested in doing. Another tool that I want to show you is the appeals form selector. We talked about this, and you answer questions, and depending on what your answers are, you can see how it interacts with you. One more tool real quick is the reason and remark code lookup. Karen showed you the X12 website. This is another tool on our website that can help you whether you're looking up a FIS reason code, a remittance advice remark code, let's say. Those codes that might be on your remittance advice, it will tell you right away, yes, this is something that is appealable. Let's use another example that we looked at, that N211. You may not appeal this decision. This is another way you can use those tools to see what those different codes mean. I'm going to jump back to our PowerPoint now because we are out of time. So now is the time that we would open it up for questions and answers. I did receive a couple pre-submitted questions. I will provide answers for those to everybody that's in attendance today. The same with any questions that were put into the chat today. We will get answers out for everyone. So wrapping it up here for you today. Please take a survey for us about this course. This is really important because it gives us an idea of how we're doing, what we could do better, and gives you the opportunity to give us suggestions for future education. There's a link in the chat that Karen placed for you, or when you exit the webinar today, you're going to be asked to go to an external site. You're going to get a message that looks similar to this box here with the triangle and the continue button. It is safe. It just wants to take you to the CMS site for the survey. Now, if you're listening to this course as an encore, you're going to get a box that looks similar to this one down here with the hand and the stars. That's going to link you to the survey as well. However you decide to take that survey, please do and give us your feedback. That's the only way that we know how we're doing and the types of education that you're interested in. In a few minutes, you're going to receive an email to thank you for attending. Make note of it because it has your contact hours. If that's something that you need to turn in for consideration of continuing education units. It also contains a link to that survey. You only have to take it once, but again, it's your preference on which way you want to go. If you don't see that email that thanks you for attending and contains your contact hours, check your junk or your spam folder and make sure that you have the WebEx email address in your safe sender list so you don't miss out on those. On behalf of myself, Karen, everyone else in provider outreach and education, thank you for joining us today to learn more about the appeals process. We hope to have you join us for future education. We look forward to that survey feedback, and you may now disconnect.